We're going to begin this half hour with a stunner. This Rawson Reports investigation, and it affects every one of us. The question is your doctor stoned? Is he using alcohol when he treats you? Before you say no, you got to see what national investigative correspondent Jeff Rawson uncovered. Jeff, good morning to you.
Yeah, this one's a jaw dropper. Hey, Savannah, good morning. We trust doctors with our lives. They take care of us, they operate on us, but government studies show at least 100,000 of them, that's 1 in 10 doctors working today, are abusing drugs or alcohol, some of them accused of the outrageous, performing surgeries while stoned, injuring, even killing their patients. Before you head to the doctor's office, watch this. You're watching a violent crash in progress. Behind the wheel, a drunk doctor reportedly heading to see patients when she flew over this median and smashed into traffic. In fact, we found cases across the country. All these doctors busted for abusing drugs or alcohol.
There are doctors out there right now under the influence of prescription narcotics as we speak, putting patients at risk.
Tennessee doctor Stephen Loyd should know he was one of them, opening up in a rare interview and admitting everything to us.
At my worst, I was doing 100 pills per day, Vicodin mainly.
You were taking 100 pills a day?
Yes.
And you were seeing patients?
I was seeing patients.
That's frightening.
It is very frightening. Frightening me to talk about with you right now.
Dr. Loyd was an internist working in the hospital ER. He says for physicians, scoring pills is easy.
I have access, and every friend I have is a doctor.
They wrote you prescriptions?
Absolutely.
A lot of people watching this right now are saying to themselves, I would know if my doctor was high on pills.
We'd like to think so, but the truth of the matter is my patients didn't know I was using.
Dr. Loyd says he's never been accused of harming a patient while stoned, but other doctors have.
Our next best doctor is neurosurgeon Dr. Christopher Dunn.
Dr. Christopher Dunn, seen here in this infomercial, once billed himself as the best neurosurgeon in Dallas. This is one of his former patients, Jeff Cheney.
You can barely walk.
Correct. And it's painful.
He went in for what Dr. Dunch called routine back surgery and came out partially paralyzed.
It's my understanding that he was under the influence while performing surgeries.
Cutting into people.
Yes, cutting into me.
He claims Dr. Dunch was stoned while operating and removed part of his spinal cord.
He turned me from a strong, healthy man into a crippled man.
A dozen other patients say Dr. Dunch botched their surgeries too, turning some into paraplegics and quadriplegics, confining them to wheelchairs. According to lawsuits, these 2 patients even died after Dunch operated on them.
Is that the kind of bottle Dr. Dunch had under his desk?
In this recent deposition, one of Dunch's assistants testified he often drank at work.
There was a bottle of vodka under his desk.
Then one of his friends described his drug use.
There's been LSD, there has been cocaine.
Dr. Dunch denies wrongdoing, but when he was under oath, he kept saying this.
Take the 5th.
Have you ever been under the influence of cocaine while you were taking care of a patient?
Take the 5th.
He declined our request for an interview and wouldn't answer the door when I showed up at his home in Dallas. But Dunch later called me to talk, but said I wasn't allowed to record his voice.
Have you ever taken drugs or alcohol within a few hours of a surgery? No. You deny that.
While he hasn't been charged with any crime and the state medical board found no evidence he was on drugs or alcohol during surgeries, his license was revoked because he violated the standard of care.
I'm going to have a listen at you if that's okay.
Yeah. Dr. Loyd says it's all too common. He's been clean for 10 years and says his fellow physicians need to take responsibility like he is now.
And I am not saying that there's not consequences. If I've harmed a patient sees this interview and figures that I harmed them, then there is a price to pay for me for that.
And you're willing to pay that price?
Of course. Part of getting better with addictive disease is owning the mistakes of the past.
The American Medical Association tells NBC News if doctors are abusing drugs or alcohol, they have the ethical responsibility to avoid harming patients. There are even special treatment programs out there for doctors. But believe it or not, there is no federal law requiring them to take random drug tests. Airline pilots have to, school bus drivers have to, but not doctors. But now lawmakers in California, guys, they're actually trying to change that. They're proposing a bill that would force random drug testing upon doctors.
It's shocking. It's so interesting to see the perspective of Dr. Loyd, who was so candid with you about his own struggles. Does he still practice?
He's still a practicing doctor. Believe it or not, his patients never realized he was using. It was his father who convinced him, you know what, you have a problem, you need to go to rehab. Cleaned himself up, loved medicine that much, he wanted to get back into it. But he has so much to lose by doing this interview, as you see, and he's just trying to help doctors out there.
He says he's been clean 10 years.
Yeah.
Wow. Jeff, thank you. It's an eye-opener.
That's an eye-opener. Yeah, thanks a lot, Jeff.